So we're gonna do the Volar splint. So we're just gonna pre-pad the patient. Usually these are gonna be done for any sort of distal stuff or any sort of like hand fractures. We're just measure it out if we think we wanna any sort of immobilize the hand. We gotta go past the wrist into the hand, but we also don't wanna be too short either. So if we just kind of measure it a little bit so we know roughly about how long we have to make the splint, we'll come on over here. You can always make it a little longer because you can always cut some off or fold it under. So once we kind of know roughly where we're going to cut it, and I always try to trim a little bit of the ortho glass away. That way you have a little bit extra padding over flat there so it doesn't kind of bother the patient quite as much. If you don't do that and they complain of some prickling, you can just tell them to take like a toenail clipper and clip it away. It's just fiberglass. Let the water run. You can either take a bucket and soak it in there if you want. I find that it's just as good just to let the water run over it. Just make sure you get it nice and soaked. You want to be pretty quick after you get it wet because that's when it's going to start to set. So once we get it wet, we're going to wring it dry and then just stop making a mess. I always like patting it dry again with the towel. And if we think it's going to start to set fairly quick, so we're going to make sure here. So like I said, I kind of always make it a little longer than it needs to be. So we can always fold it over. You can always cut it if you want. Folding, it's okay too. As far as the wrist goes, we're gonna be in a little bit of extension. We don't want to be completely straight. So just a little bit of wrist extension is fine. Usually it's nice to have an extra set of hands. In this case, I can just ask Steven to just hold it here for me. And then we'll go through with the ace wrap and try our best to get it nice and snug. Try to be fairly quick with the ace wrap because we want it to set where we want it to. So once we get the ace wrap on there, we can get back in there with our own hands and kind of help mold the splint where we need it to mold to. I like telling the patient you're going to feel it start to warm up as it starts to set. So don't be alarmed if it starts getting hot. So I'm going to get in here and really shape the splint to his wrist, hand, and forearm. And then I'm going to pay special attention to wherever the fracture site is, and I'm going to just make sure that I kind of assess above and below the fracture site to make sure it heals where I want it to heal. And then I'll just stay here until I feel like it's nice and hard. It usually takes a couple minutes.